Well, good morning. This is Matt Minarik, and I'm glad that you are here. Today, we are discussing mental health in the workplace with my partner, Nancy Kowaleski and Shanna Dunbar of Workplace Health. And I'm Matt Minarik, founder of RX for Mental Health and the parent company Restore Health. Today's session will be recorded, and everyone who registered will receive a copy of this recording. We're going to have you ask questions through the chat, and at the very end, which will be about 25 minutes, we will open up those questions and answer them. And so I thank you all for joining in, and let's get started. And I'm going to turn this over to Shanna Dunbar.
Well, hi, everybody. It's so nice to see you. And those of you that know who I am know that I am all about finding great solutions for employers that are cost effective and can really do a lot to advance employee well-being and productivity. And today is no different. I'm hearing a lot of my employers talking about the challenges that they're finding with mental health in the workplace. So today's presentation is going to be all about the mental health in the workplace. And I want to start by sharing a few statistics with you. Go ahead. There we go.
Yeah, sorry about that.
That's okay. And, you know, the old way, we have some things in place. A lot of employers are using employee assistance programs. The challenges that we're seeing now that sometimes is not enough. So I'm going to be offering some statistics and things around other ways to look at it so that we can find new solutions, maybe that are easier even to address mental health for our workforce. One of the statistics that and by the way, we have links to all of our resources on this. So when you will get a copy of these slides, so you'll have all the links that you can also do your own research on this, if that's something that will help you, maybe even help you sell it at your company, you know, to say we need to address mental health in some kind of way that will help you as well. But when employees were asked, what would you say is the single most important health issue facing the nation, it was around mental health. And of course, this was during the pandemic, but this trend was starting even before the pandemic. So we're seeing it in the workplace as a lagging indicator still because of more attention, I think, that was around it. The stigma has been less around mental health. So we're seeing this as definitely an employee concern as well. So here's some of the things that we know. 1 million American workers will miss work each day because of stress. And again, this is perceived by those workers. 51 billion per year is depression-induced absenteeism costs for the US businesses. An additional 26 billion in direct treatment costs. 75% of workers' annual salary, the amount that companies spend to cover lost productivity or to replace workers. We know these as the indirect costs that can affect healthcare. 63% of the US workers are the workers ready to quit because of due to stress around the workplace. And this is costing employers about $15,000 per employee when you consider both the direct costs and the indirect costs of mental health. 76% of the workers believe their company should be doing more. We're finding that. In fact, there was a recent study by Duluth that you'll have a link to in just a moment. And the C-suite is perceiving that, you know, they're doing a great job in addressing mental health in the workplace. And the reality is the employees aren't feeling the same way. So there's definitely a disconnect. 78% of the workforce say that the pandemic has negatively affected their mental health. Wouldn't we all agree? And even though the pandemic is pretty much over, there's this lagging indicator that we're seeing that there's still some mental health challenges, especially in the younger worker. And 85% of people say their mental health issues are causing all these other kinds of problems like sleep issues, poor physical health. I know some people will eat more when they're stressed, and also their family relationships are suffering. We know that people are saying that they're experiencing stress at work within the last, 12 months, and 11% have thoughts or feelings of suicide at work because they're so frustrated. 73% of those with mental health issues say it's affected their work, meaning that they're taking time away from work or their quality of work or relationships are challenged as well. And this is from the Industrial Safety and Hygiene News. 75% report that their workplace does not really have an overall mental health strategy. And this is where some of you who know who I am, I talk about total worker health concepts a lot. And that's where we actually integrate what we're doing on the physical safety side with promoting the health throughout the workforce. And really blending these together is the best way for you to get the very best results. So you need to have a strategy around that. And if you're looking at total worker health, mental health is definitely a piece of that. 8 out of 10 workers with a mental health condition say that shame and stigma are still preventing them from seeking mental health care. That's starting to change, but I think we as employers can really do a better job there. And nearly 3/4 of workers say they want their employers to champion mental health. Sometimes it's just saying it's okay to take a PTO day just for your mental health. Just acknowledging that mental health is definitely part of the whole total worker health strategy. We know this is, again, a study that was done by Kaiser Permanente to show the costs around mental health in the workplace. This is saying that it's about $9,500 a year of the indirect costs with absenteeism and lost productivity. We know that there's 62% of missed work days are attributed somehow to mental health conditions. And that the total cost, like we mentioned before, is about $15,000 per year when you consider direct and indirect costs per employee per year. And we know that without treatment, that there's a 35% reduction in productivity, which is definitely a burden on employers. And with treatment, employees really do very, very well. 80% of the employees that sought treatment actually improved. I'm not sure I can say that in a lot of physical health conditions, but here, mental health, the statistics speak for themselves about the effectiveness and satisfaction people have once they actually do get some help and treatment. Effective treatment is a win-win for employers as well as the employees, with lower medical costs, increased productivity, lower absenteeism, and decreased disability costs. I mean, you want your employees, when they take time off, so they can go do something they enjoy, not because they're so stressed out that they need a day, for a mental health day. We all would rather be doing something that we enjoy and for fun when we take time off, and not just because we need a break. And I do want to say that, my background besides nursing is in kinesiology, and we did a lot of study around the athlete and stress in the athlete. And look at this chart on the left. It's one of my favorite charts about performance and stress. When you don't have a little bit of stress, you actually are bored at work, you're less attentive, where we know optimal performance for athletes and for our employees come when there's, peak performance. There's a little bit of get up and go along with, with our engagement. So I'm not saying that we want to say zero stress. You're going to have a little bit of something to help you get up and go, but you want to just make sure it doesn't get over on the other side of the curve where you're starting to get anxious and, end up with a meltdown or burnout because you're so stressed out.
Sean, I'm going to interrupt here.
Sure.
This is the picture of the 2019 South African rugby team when they won the World Cup. I played rugby for the Cleveland Rovers for 10 years. I was a head coach at St. Ed's and I refereed. I purposely put it in the rugby picture. Excuse my
no, it's totally great. I mean, because I know that our workers are not athletes, but in this kind of consideration, we do need to remember that there is some get up and go, and stress, quote unquote, is associated with productivity.
And we, as athletes, we loved the big games. Absolutely loved them. You are at your best performance. There's no question, right?
Yeah.
But you can't practice too much. Then it goes over the edge, right?
Right. Exactly.
Yeah. Okay.
It's good to keep in mind with our workforce. And I'm not going to read this very busy slide, but there's key findings in a mental health report that was published just this year. And you'll have a link to it. I mean, it's several pages long, I think 25 or more. But there's a lot of really good statistics in there about the current state of mental health in America today. So it's not just an employee problem. I know that some employers kind of think, well, somebody's mental health, it's just up to the employee to have to figure that out. And I believe employees need to take more personal responsibility for their mental health, but we also can make it easier for them in the workplace, just like we've done for physical health. And I think there's several stakeholders here that we're talking about. Of course, our C-level, senior managers, human resources, our wellness people, if we have a wellness team, the managers and supervisors, and then, of course, the employees themselves. So let's take a little bit deeper dive at each of these 5 circles. So the employees, what they're finding when they are looking for mental health solutions is there's a long wait time. Even if they've had some EAP, their employee assistance program, and had 3 or 4 maybe counseling sessions with EAP, it flips over to the medical spend. It flips over into medical insurance, and the medical profession is not readily available to accept new patients. Some places are waiting, 2 and 3 months to get in to see a mental health professional. So I think there's some limited provider options. There's some out-of-pocket costs that kick in when you flip it over, especially with these high deductible plans where their insurance, they may be self-insured, if you will, as an employee for the first $6,000, right? These high deductible plans are $2,500 high deductible plans, and they're not going to necessarily seek the care because they have to pay out of pocket for it. There's still some concern over confidentiality, and certainly meeting in person takes time away from work. And then from the wellness perspective, all of you good wellness champions out there, we know that we like to show our employers a quick return on investment, because if we show quick return on investment, we can secure funding for the next programs that we want to offer. And we want to really target the engagement. So it's not just that 20% of our employee population that might be participating in wellness because they're worried. We want to really gain access to many more of our workers and make sure that we can provide those good metrics around absenteeism and productivity and disability. And what I found is good mental health programs can really drive the rest of your wellness program, especially now. And then in human resources, we know that human resources are struggling with recruitment and retainment right now. The new worker is really looking for a very broad brush of benefits when they look at an employer. In fact, benefits are starting to become much more important than actually the amount of money they make. If a new worker maybe is offered a job that may make 10 or 15% more money, but they don't have the kind of environment or the culture that they're looking for, they will definitely take a lower paying job that offers them that culture. And certainly offering the right care with the right timing, with the right cost is a great way to offer your benefits. And, if we're addressing these mental health issues and really making sure that employees are taking more personal responsibility for their mental health, and we're making it easy for them to do that, those are the kind of solutions that we're working for. And here's another note about workers under 35 ranked mental health benefits is #1. So I think even beyond employee assistance programs, looking at other solutions can really help. And then let's look at the managers. When you have a workforce that is more mentally healthy, if we can say, or more resilient, or have learned some coping skills because they've gone through some coaching and training with a counselor, there's going to be less employee conflict. They're going to be able to just have conversation without anger bursts, or having just better conversations around it. And, it's nice for managers to actually have a solution or to be able to offer a benefit to somebody if they identify, they may be close to their workers and identify some mental health challenges even before the worker sees it themselves, and can offer some solutions for them. That puts the manager in a great position. And then, of course, the C-suite. We need to make sure that we're offering programs that help show that it's improving not only employee productivity, but profitability for the company. We need to make sure that we're reducing disability, time away from work, mitigating the risk. And there's some great information out there about the C-suites are actually struggling with their own mental health issues. So why would we not want to have some kind of offering that would be appropriate for a C-level executive as well as for your brand new employee just starting?
And Shanna, I apologize. I forgot to put
Yeah.
that link on there for Deloitte. I'll put it on before we send it out. All right.
Okay, that'd be great because
Okay.
that's a great article. So anyway, ideally finding a solution to satisfy all 5 stakeholders is really the sweet spot. And that's what I was really encouraged about and why I wanted to partner with Matt and Nancy to help other employers understand about this. You know, this company's been around over 10 years, but I had just learned about it a few months ago. So I figure, you know, I'm on top of my game with keeping resources out there. I wanted to make sure you can be on top of your game too. So I'm going to flip it over now to Matt to talk a little bit more about this choice.
Thank you, Shanna. You know, we have found out, I don't sell a health insurance. Nancy, my partner, does. One reason why she's my partner. But we found out that health insurance may not be the best choice. First of all, there's high deductible costs, which you talked about. And then is there adequate coverage? Does everybody get to be covered in the whole household? Premiums keep increasing every year. We talked about family. What about teens who need help? And what about wait times? You know, sometimes you have to wait 6 or 9 months, and then you finally get a provider. What if this provider doesn't turn out to be good? Then you have to maybe get another one, takes another 6 to 9 months. And then, of course, there is stigma. Is a huge issue around stigma that still happens today. And you talked, Shanna, about the EAP utilization. We know EAP can be very good and used very well, but sometimes employees just don't use it that much. I think, would you say it's about 1 or 2%, Shanna? Oh,
yeah, I agree, Matt. It's really low utilization in my experience.
Yeah. So are there any other options out there but insurance? Because it's you know, maybe we need something else. Well, let's ask this question. Can you imagine a mental health solution that is not tied to insurance, so it doesn't affect the premiums, is actually affordable? It's not $195 per session. It includes the whole family, especially the teens today. We know how that is. And it's anonymous. So no one knows in the company that you're using it. No stigmas attached to it. No reports go anywhere. It's all totally private. And it's available with a multitude of nationwide providers. It's high quality of care. That's obviously, very important. And it's easy to use and has high accessibility. Well, that just sounds great. Where are you going to find such a solution, right? Well, we found it. We found it years ago. I started my company actually as a virtual direct primary care company. And that's how I found this solution, because when my primary care providers could not be out there, I'm a retired PA, I wanted to find a solution for them, someone to talk to in the middle of the night. And we found Teladoc. So we partnered with them years ago. Teladoc is the perfect solution. Everything is virtual. It's online. And then we partnered again with our third-party administrator New Benefits. Teladoc was formed in 2002. It's the giant elephant in the room. It is the oldest and largest telemedicine company in the US. It's got 56 million paid members. And then we partnered with another beast in the room, and that's New Benefits, as third-party administrator. They've been around since 1990. Joel Ray is a phenomenally good human being, and they service over 25 million members. And who are we? Well, we've been around with my partner since 2009, and we have New Benefits and Teladoc, and we service tens of thousands of members. So I know what you're thinking. Teladoc, well, that's great. But isn't Teladoc expensive? Well, normally, Teladoc is expensive. If you look on their site directly, they're going to charge $99 per visit, okay? But because of our relationship, we are different. With Teladoc Mental Health, we offer this for just $39.95 a month. That includes the whole household. And that doesn't mean that it's $39.95 for the mom on the left, the 2 teenagers in the middle, and dad on the right. It is $39.95 for the whole household. Even if they all have different therapists, there's no extra charge. And so this is obviously an affordable price. And it's accessible. It's in all 50 states, and it is nationwide availability. And then we have the experience. They have the experience. We have the experience with our partnership of 25 million members. And it's all licensed doctors, psychologists, therapists, and even psychiatric consults. I had a friend of mine call me up and says, Matt, are you doing this mental health? I said, I sure am. He said, we went to the psychiatrist for my one son and they wanted $4,000 for an evaluation. I said, no problem. You get that evaluation included with it. And they're happy members right now. There's no contract with people who sign up individually with employee groups. There could be and may not be. We have to talk about that individually. But there's no contract. It's month to month. And there's no need for open enrollment. We're not insurance. So they can sign up anytime and they can quit at any time they want to without any complications at all. Now, this is a really phenomenal price. And with my TPA, they're saying, Matt, it looks like the price is not going to stay past January 1st. We don't think the price of itself is going to go up, but we think we're going to have to add an added fee, like $20 per call. We'll let you know, but it's not going to happen probably till January. All right. So let's talk about the cost of mental health care until a patient gets improvement. Studies show that it takes about 12.7 sessions until about 60% of patients see a real improvement. All right. What does that cost? So along the traditional lines of insurance, one session, assuming one session every 2 weeks at 12.7 at $195, that's about $2,500 that's going to pay before you see that increase. With RX for mental health, the same amount of sessions at the exact same time were less than $300. This is a huge cost difference to get improvement. All right, it's truly remarkable. All right, so look at the impact that we have. We have happier, more productive families, employees, and families. We have reduced turnover. We have, and all the employees enjoy a lower cost with zero consult fees, low monthly fee. It's not coming out of their pocket like these huge expenses of $195 per session. The HR likes this because it attracts and retains new hires, and it's virtual. So employees can help, well, they can be the privacy and comfortable location of anywhere they choose, and it shows improved employee satisfaction. And then this last statistic is great for all the CFOs out there. Increased productivity of a 4-to-1 positive ROI. This is according to the National Safety Council. Employers that support mental health see a return of $4 for every dollar invested in a mental health treatment. It's like going to a vending machine, putting $1 in and getting 4 out. How often are you going to keep doing that? Just keep on doing it and doing it. So that's what we offer at RX for mental health, but we offer a little bit more. We actually give you 4 benefits. Of course, we give you the mental health, but we also give you a 24/7 counseling service. The mental health behavior, that's a schedule. You schedule it every week, every 2 weeks, every month, how often you need it. But if at 3 o'clock in the morning, you're feeling that you need to talk to somebody, we have a 24/7 counseling service line, and they could work with you to up to 6 sessions until you get to that scheduled appointment with the teledoc mental health. And then if it's, midnight and your 4-year-old has a fever, what do? We also include the teledoc physician services, 24/7 for the whole family, accessible anytime. The last one I want to talk about, what we offer, is truly a favorite of mine. It's Health Advocate Solutions. We have 6 children in our family, and over the years, we have used Health Advocate because we've had our children go to the hospital. We get these huge bills. We can't figure them out, and there's a lot of stress going on with medical bills. As we all know, the #1 cause for bankruptcy in the US is medical bills. And so these providers would keep calling us and say, you got to pay. We say, but this is too much. No, it's not. Pay. And so that causes a lot of stress. They get threatened with bad credit ratings, et cetera. All we did then was we turned over all our bills to our health advocate. They then take over from there. We never got a call from the provider again. But every week they would come back to us and they say, Matt, we're still negotiating. Do you have any more data? Or we don't need data. They're just waiting to get back to us. Finally, we had one bill. My one daughter was in the hospital, Ohio State, an emergency room, and then into the hospital. And they said, you owe $2,000 for something. And we couldn't pay it at the time. Or we debated it. And so they came back about 2 weeks later and said, would you be willing to pay $750? Yes, I would. So we paid that $750 and they did that. They also find appointments for our children. We had one child who needed a pediatric podiatrist within our insurance. They found it. And they find senior care and special needs care for family. Health Advocate is a truly fantastic service. And this is all separate from your health insurance. all without claims in your health plan. There's no codes or co-pays or deductibles. So there's nothing that people are going to get stuck with. There's no added fees. The employees are going to use it then because of that, which is a really important thing. I'm going to show you a slide on that in just a second. The average therapist bills through normal insurance on $195 per session. That's a lot of money. More healthcare claims means bigger rates next year for the company. This is totally separate. This actually we've even shown that it decreases claims when people use our telemedicine service for the medical or the mental health. There's less claims, and so actually rates, they don't increase as much, we'll say that. Typical telemedicine, by the way, with insurance companies does not cover the whole family, but ours does. Now, what we also do, we're not just this service, we also provide back office availability. I want to show you, on the far right, we have 82% excellent rating with a Teladoc Mental Health, only 18% good. I'm surprised it's not 100% excellent. But this shows the net savings. And how did we get this example of the net savings? This is an actual client of ours. They have about 400 employees. So they asked this question down here: where do you go if Teladoc is not available? And 61% said they would have no treatment. Now, we know from our earlier slide. So, and by the way, that's how they determine the cost, because other ones say they go to the emergency room, they go to their PCP, they take those averaged out costs, and they multiply it in, they weight it out, and that's how they get that $93,000. And that's just the cost of where you would go. But more importantly, if 61% don't get treatment, remember the slide, the treatment, no treatment, the 80% satisfaction versus 35% decrease in the productivity. This is big stuff where people actually use it. And down here, you can't see it, but it is EAP. No one's using the EAP. And we even have it as an option with this group, but nobody's using it. Once they have this mental health, they use that. So how do people pay for this? There's 3 ways. We also partner with some companies who want to offer this to their clients. And so it can be totally employer paid. That usually gets the best utilization, employee shared, or a payroll deduction. And Shanna, could you talk about some of those programs that are out there about wellness?
Yes, I know some clients are having some wellness incentives, like maybe they would give reimbursement for somebody using a gym membership, for example. And I think this is the same kind of solution you could offer. You could choose to go to a gym membership, or you could use RX for mental health as one of the wellness offerings that you offer that you can reimburse an employee for. So I think there's lots of different ways we can look at this, and it would take the specific employer, what your circumstances are, and we can help help you come up with a plan that I think could be very doable.
We even have plans where a certain segment, the company pays for totally, and then they offer as a volunteer for other ones. We're very flexible on how we do this. There's no one way fits all. All right, so what are our next steps? We're almost done with our little talk here. And the first thing is, everyone who registered, we get this presentation emailed to you, and you may pass it on to anyone you like. And then there's also links to all the references, and I'll put the Deloitte link in there. And then you'll get an email from me or Shanna or my partner Nancy. But you can have further discussion options within that email. Now, what you can do if you get this presentation and you want to just go one way or the other, we have a QR code, and on that QR code, it gives you the options of directly talking with Shanna about her strategy. You can talk to me directly about the program. You can download that State of Mental Health in America report. You can go right to RX for Mental Health. And then we have a 20-minute overview for the plan, how that all works. And then right here, we have Shanna's contact information, and we have mine, and we have that QR code again. And that is our presentation.